Now, that was the Deputy Director General of Health, Dr. Anban Pillay, speaking at that very long and technical briefing hosted by him as well as the Minister of Health. And that briefing was hardly completed before my phone lit up with family members, my mother, people asking, what does this actually mean? I didn't really have the answers for it, but I know somebody who does. Rofhiwa has joined me in the studio to help unpack all of what we've heard this morning. It is a lot of information, Rofhiwa. Start us off. What does this mean?
That's right, Marcel. It's a very big and technical policy document that's been developed here about the healthcare system in South Africa. But what it essentially refers to is that there'll be the centralizing of the healthcare system in South Africa. So essentially, government will control the healthcare system, the entire healthcare system in the country. So the NHI would essentially become the country's biggest state-owned entity, given that all the funding and all the tenders through it will come from the government. And so the implementation would cost around 357 billion rand. This morning, government indicated that it would be around 200 million. But trade union solidarity figures this could be a lot more if it's not done properly. So let's have a look now at some of the footing the bill and who is exactly going to be responsible for footing the bill. So currently over 80% of the country's population doesn't have access to adequate health care. So that's what's going to be paid for there, taking care of over 80% of the country's citizens. This could be funded by hiking things like our taxes, so the VAT, pay as you earn, and personal income tax. But some analysts are saying that the likes of VAT would have to go up by double so that we are able to get the adequate funding to get the healthcare system in terms of the NHI ball rolling. The problem with that, though, is that it's the middle-class income South Africans who are going to be footing that bill. And in the current economic climate, that doesn't seem very viable at the moment. So let's just look at the effects of the bill in a nutshell. So the private sector is saying that it's going to be less empowered. And I think one of the reasons that go into that is the fact that they will only be selling services to government as they are necessary. And of course, taking the relevance of medical aids in the next few years to a very minimum. It will also mean that fewer South Africans will have access to adequate health care. And this all goes down to proper and quality leadership when it comes to managing the state-owned entity. Because if that doesn't happen, Marcel, we've seen it with Eskom, we've seen it with SAA, we've seen it with the SABC. It could end up being another indebted state-owned entity. And of course, that would cause high medical aid costs, medical costs rather, and of course, little development of new hospitals as we deal with that deficit.
I suppose the big question now is when they say that your own medical aid will change the way it looks in its present form. That's the one that's got everybody up in arms, because what does that actually mean? The private medical sector is a business that sprung out of the fact that public health care was just not adequate enough. So I think that's the question that is on everybody's minds at this moment.
That's right, Marcel. So what the government is essentially saying here is that they're going to have the NHI as a body that gives cover, broad-based cover for all citizens without paying the costs that we pay for medical aid. There was an analyst on earlier on who said that our medical aids, if you and I are fortunate enough to have one, is depleted by August. With the government one, the structure is different and it covers a lot more than traditional medical aids do. So those services that you pay astronomical amounts for already, you could find within the cover offered by the NHI, which therefore talks to the fact that medical aids, or traditional medical aids, will lose their relevance in the coming years.
So it all sounds great on paper, but unfortunately, because of our recent history when it comes to state-owned entities, a lot of people are a little bit concerned. Thank you so much.
Right.
You were unpacking a very, very complicated story for us, and she'll continue to do so throughout the afternoon.